If you imagine I'm a scale measuring my emotions. Some days it can be like this, and other days it can be like this. But through Champions of Change I've found a balance, and now I have bright ideas.
Hello, my name is Andrew and I'm a champion of change. My life story began about 20 years ago when I had a mental breakdown and was institutionalised into a hospital, and for 7 years I was in and out of hospital, suppressed by all different types of medication. I was unable to concentrate, focus on anything due to the medication that I was receiving, and basically it wasn't a very good experience for me all the time that I was in and out of hospital. I felt as though I wasn't really given much support within the institute. There was a lot of negativity on the wards. There was no kind of communication with carers and patients. A lot of the time I felt very withdrawn and secluded within myself because of the medication. The first time I heard about Champions of Change was through my support worker. He introduced me to Champions, and at the beginning I was very nervous and a bit weary of what to expect. I became a champion of change because I want to make a change within the mental health system. Since I've been with Champions has encouraged me to be more confident with myself and helped me to be more communicative with professional people and be more upfront with a lot of issues that I feel passionately about that need changing within the mental health system. But my expectations with Champions has been limitless. The impact that Champions has made on my life, it's gave me confidence, even more confidence than what I had. It's gave me the ability to be more assertive and more upfront and more open with talking about how I feel about not only my mental health problem, but with a lot of other problems that I know of that other people have gone through. If Champions is to cease, then all the work that Champions have done so far, it's just going to be swept under the carpet. And it's people's lives that we're dealing with. It's not just something that's on paper.
But I could swear I'm upside down.
Hello, my name is Lisa Jackson and I am a support champion lead for the Champions of Change project.
I'm Simon Morley and I'm a support champion.
Champions of Change is a funded pilot delivered by Bright Ideas. It was funded by the NHS Nottingham City because the NHS Nottingham City saw a need to explore more effective ways of engaging and finding out the views and opinions of people who use the mental health services that they commission here in Nottingham.
The aim of the project is to engage with these people who have used the services in Nottingham to find out what works and what doesn't work. Obviously to look at more of what does work and feed this back to the NHS for improvement of the future of these services.
I suppose the NHS, they could, if they wanted to, go directly to the services that they commission. But it's even better if actually you ask the people that have experience of using those services so they get their perspective. So that's what Champions of Change is about. It's about using people's experiences to identify gaps or ways of improving a service, or looking at the good that certain services deliver as well.
The first area of the Champions of Change model is the Champions Network.
I'm a member of Champions of Change. I'm actually one of the champions.
Hello, I'm Sean Potter and I'm a champion of change.
And I'm a champion of change.
I'm a champion for change.
And I'm a champion of change. Champion of change. Champion of change. Champion of change. Champion of change.
Right, the recruitment process of the Champions Network, basically we went out into different communities. We went to places like the Involvement Centre, various community groups, mental health groups, bipolar groups, Super Sundays, and any sort of health related event. We went out to all different areas of Nottingham, Bulwell, Clifton, St Anne Snenton, so all various events. We took a stall out there, we called it a Champions stall, which had all information about what we did, t-shirts, etc., and just engage with people. And people were really glad to hear about the service, and they were saying that it was a much needed service, and really a lot of people wanted to come on board.
The main things that champions could expect from the project is being the support to get their voice heard, so that they could help from their experience to help improve the services that they use.
Also, champions could gain a lot of confidence from being part of Champions of Change. A lot of the champions have really grown as they've started voicing their opinions, and that we've actually watched them grow in their confidence, and also empower other people to voice their opinions as well. They've also gained various training, as in different sorts of IT skills and that, like setting up a blog or learning how to influence online patient participation panels and things like that.
Yeah, and attending meetings as well, because a lot of people, a lot of the champions on the network may never have had the opportunity to sit as an equal partner in front of commissioners. The way that once someone became a champion of change network member, there was various different ways that they could engage within the project. So one of those would have been looking at doing surveys, various different surveys. They also had the opportunity to attend the third sector review with the NHS Nottingham City. We kept them alert and up to date with other conferences, workshops and events around mental health. One of the main things about the network was trying to find the right language, how people wanted to be referred as, because devising the various different forms and leaflets that we needed to put out into the community, we did need to check how people wanted to be referred. So we did get sort of a lot of feedback from people saying they don't like the word, for instance, service user, because a service user, in their opinion, was someone who was a user. So as a group of champions at that time, the decision was made not to use that label or that word within any of the leaflets or anything that we did really, or even within our meetings, that we wouldn't use that word service user. I know we go all around the houses by saying someone who access mental health services, but it was very important to make sure that people felt comfortable about the shape of how that network looked and how it was portrayed.
With Champions Up on the network, we decided to officially launch it, which we did at County Hall, and we launched it as the second year of the Champions project. So we invited obviously all the champions, plus they could bring a family member or whatever. The commissioners and people like that were there, and we looked at, we spoke about the successes of the first year of the project, and we also looked at sort of an election process to ask people to come onto the commissioning group, which it was at the time, wasn't it? So we got everybody to put in on tables, do it in a group thing on a table, and ask how they would like people to be elected to come and sit on this group. So,
because over quite a few months, Simon and I, we was out and about in the community, looking for specific people that have experience of using mental health services that Nottingham City and NHS provide, and also carers. So once we managed to get a good number of people together, I didn't know who Simon had recruited to the network, and Simon didn't know who I'd recruited to the network. So it was a very, very, very special time, actually, to bring everyone together and see the power of what had been achieved. And not just for us, we were really overwhelmed, weren't we?
Yeah,
really taken back by it. but for other people to know that they're not on their own. So, you know, we may have collected their opinions on various different things, but it was really powerful for them to actually meet together as one single joint voice.
I'm not breathing.
The reference group really came out of the need from the champions themselves, really. As you know, with the network, we have people of all different wellness levels. So some people can engage within a group setting, some people prefer to do more of a one-to-one. So if we needed to find out or engage with them, we would go to their homes or talk to them over the telephone. But within that group of champions, there were ones that were very articulate and wanted to represent, to have more of a visual presence within that network. So that's where the reference group came about, isn't it?
Yes. Yeah.
So basically with the reference group, it was a number of champions that were happy to be quite visual and want to go to the NHS commissioning meetings, the Nottingham City Council commissioning meetings, so that they could speak on behalf of the rest of the champions. So the reference group really was a way of meeting on a monthly basis to prepare people about various different meetings that they would be attending. So it'd be looking at the agenda, looking at the minutes, looking at how etiquette really, wasn't it?
Yeah.
Meeting etiquette, because
Yeah.
some people may have never been put into that setting before. So those meetings were there to prepare champions, but also to look at what the rest of the network was saying so that we could analyse and dissect what information that we needed to take to those meetings. I think as well, one of the positive things, sort of reflecting back, is changing slightly the format of different meetings that we've attended. For instance, the commissioning group meeting that was formerly known as the joint commissioning group meeting, it became a little bit more sort of relaxed and user-friendly in a way. The NHS Nottingham, they saw the need to not necessarily always meet within a small room over at Standard Court, but they also felt the need, after dealing with champions, to actually go out into the community as well and to hold meetings in spaces that were familiar for people on the network. So that was a positive change.
Another part of the model of Champions Change was seeking views to influence change. And this was done by various engagement and consultations.
One of the consultations that champions have been involved in is a survey, which is quite relevant for this time, which involves how does your family doctor care for you, or what does your doctor do for you. And basically, we wanted to seek out the views and opinions of different champions' experiences when they've been to their GP and how their GP have supported them with their mental health and well-being, which is quite a crucial time really, because as most people know, that GPs will very soon be responsible for the commissioning of mental health services and not the NHS Nottingham City. And what we wanted to look at is the fact that most people, if people go to their GP at a very early stage of identifying that they are not well, they do have a better outcome. And in the first year of Champions, what we did do, we spoke to over 1,000 people, and within those 1,000 conversations that we had, there were so many main key themes that kept coming back up, and one of those was around relationships with GPs. So that's how we came about the GP survey.
Another consultation we did was the BME Regional Toolkit, which was for people from black minority ethnic backgrounds who were mentally unwell. And a couple of champions from the BME community actually attended, and people were giving their views on how to be engaged with by services, if there's any differences, cultural competency, that sort of thing. And the document was created from this consultation, so it's another involvement the champions had.
One of the other ones was the third sector review that the NHS Nottingham City carried out last September. Basically, there was about 20 to 25 champions from off the network that went along to an actual event to look at and revise a new model, a new pathway of various different services that the NHS had created after carrying out a review of services. So champions went along to that, and then also after that they did devise a report on how they felt that they should be engaged in the future, and also what they thought to that particular pathway.
Another consultation we did was carers respite. Basically, we've got obviously carers on the network as well, and it's basically who cares for the carers. You know, being a carer, an unpaid carer, can have detrimental effect on the carers' mental health and well-being also. So we looked at ways of respite, and in fact, if people had even heard of respite, to give them a break, have they had a holiday in the last 10 years or whatever. So we did a survey around this and gathered information on what people thought about respite and how the carers could actually receive extra support. The fourth area of the Champions model was promoting engagement and involvement. This covered various different subjects, i.e. politics. We had a thing called we had an event called I Don't Do Politics at the Council House, where the chair of the House, the Speaker of the House of Commons, John Burko, came to speak to us and basically tell people how you can get involved with your local MP. So that's another way of raising issues and concerns, by writing to your local MP, and in fact the process of that.
We know one of the champions on the network won some books to give away for World Book Night, and she contacted us and said she would like these books to go to champions. So we thought maybe we could be quite creative with this, and because we was looking at language and literature, we thought maybe we could look at the usage around language and mental health. So we did have an event at the library, at the Central Library in Nottingham.
I'm Sharon, and I'm a champion of change. It's helped build my confidence up. I don't see these people who are consultants and they can make all these decisions for you. I'm not scared of them now. Positives is there's a lot of support, and well, there's an awful lot of support, and I'm known. People know me. You know, they don't call me or Mrs. Sums, whatever. They call me Sharon, you know, and that's good. That is good. I felt as though we could do more. I think it should continue, because then we could do them things that I suggest, you know, go in and talk to patient that's in there about us, so that they know we exist and they can come and join us when they're out of the hospital. And that's the A wards in Queen's Medical, but then you've got the wards at Highbury Hospital as well. And not once have I been said, oh, do you want to go up to Highbury Hospital and talk to people? You know, especially as I've been there myself. I'm going to miss it.
Okay, well, I live at Highbury Vale, which is near to Bulwell, and Bulwell had a wellbeing fair, and there was a Champions of Change stall there, and I just got chatting to Lisa, and she told me all about the programme and asked if I'd be interested in becoming a member, i.e. a champion, and I said yes, it sounded like something I was interested in. Over a number of years I've suffered with depression, anxiety, post-traumatic stress and stress, and I have been to the doctors on a number of occasions over the years to deal with different various problems. I've always felt I've never really moved on. You know, I've kind of treated the symptoms but never really progressed, and I've had to take it upon myself to try and move forward and overcome hurdles. I've been to a number of the events through Champions of Change, and I've looked at the website and read the literature that's come through to me, texts and emails, and I found it all really helpful and useful. And I think basically it's just given me an idea that, you know, there's no shame in having a mental health problem or being a carer of someone with those problems. And the Champions of Change forum and ideas help you move forward and give you innovative ideas in order to overcome these problems and help you connect with other individuals. The impact it has made in my life is it's given me a greater understanding of mental health problems, and it's kind of destigmatised them in a way for me, and kind of given me some self-acceptance about where I am with my own issues. Probably the biggest impact that it's had on my life is that it's made me realise that you're not alone, because I have felt quite isolated at times with different problems. And what it's done is it's shown me that, again, there are other people out there, and there's organisations who you can contact, and you know, basically can signpost you to information that you might need to help you. I think there's a huge positive with the project, and I think it'll be a shame when when the pilot comes to an end. Basically, I think there's a huge need and demand for a service of this kind to help people with mental health problems, to help destigmatise the problems that they might have and help towards making them feel more normal. I just think if the project is to be continued, and I really hope it is, I just think it should be rolled out on a national scale, you know, to cover the country. I will be really sad to see the pilot finish.
We'll see.
Champions, you gave a voice to us, BME and all. You let us stand tall. Champions, you gave us courage and voice with good support to ask for a choice for change. Champions, you gave a chance to be heard so we could give a word to you, the executive NHS, to address the issues we need. Champions, you got to the grassroots, signposted the way, got some of us to stay to have our say. Champions, thanks to you, friendships have been made, relationship community paved, and we want to stay. 'Cause nothing can steal from a vibe of empowerment that helps us to heal.
opportunities to talk, because it's the talking that helps you to realise your own health needs, and then you're able to support more people. So, with Champions of Change, I would like to promote more MOTs, which is more opportunities to talk.
To